Okay, now we're here. Yay! Welcome.
I'm doing good.
Bem-vinda.
I'm happy to see you.
I'm happy to see you. It's been too long. The last time I saw you, we were eating some good seafood at a nice surf town, and that was wonderful. That's the beauty of Portugal. So welcome if you just joined. Again, this is Fertility Fridays with Dr. Lynae Brayboy. I'm the Chief Medical Officer and co-founder of Ovom Care, and I'm delighted to have a special guest here today. And it looks like I'm tearing up about it, but it's really not. It's just my allergies. I promise you. So I'm super happy though tonight, to be talking about a really important subject, something we don't talk enough about in medicine, let alone reproductive care. And that's the mind-body connection. And, it's extremely difficult to go through an IVF cycle. I don't think we talk enough about the emotional toll it takes on the person who's going through IVF, the couple who's going through IVF, and their family, their friends, also the workplace. And people you don't really know. This is not something we share, openly. You break an arm, everybody knows, oh, can I open the door for you? Oh, can I, grab your bag for you? But infertility can cause some wounds, and some issues. And so I was saying before Instagram so rudely interrupted me that, a colleague of mine said, if you don't deal with your emotions, they'll come out of your fingers. Yeah. And they do. And so I'd love for you to maybe introduce yourself, first of all, and tell us a little bit about who you are, what you do. I know, but tell everybody here who's tuned in.
So thank you, first of all, Dr. Lynae. I'm very happy to be here with you today. So I'm Anne-Marie Pereira. I work as a fertility and emotional healing therapist. As you were saying, I work a lot with the mind and body. So everything that's not seen, not told, with women and couples that are looking to get pregnant, going through IVF, and also after loss. So that's my main focus.
Yeah, thank you for explaining that. I think the average person has maybe never encountered someone who is a mind-body coach. Can you talk about maybe what does that mean and how do you help people?
Yes. When we say the mind and body is basically looking at how our thoughts and our emotions are impacting our body. So let's look at an IVF process, for example. If my thoughts around that process are negative, then my body will tend to react in that negative way. So what we see a lot in women is they're quite preoccupied about their age, about the quality, about everything that doctors say, and doctors do their jobs, right? But they don't always have the best way of saying things. That's the big feedback that I get. And then it's very easy to go into that loop of I'm too old, I'm going through geriatric pregnancy because of my age, or hearing certain diagnoses as well. So these thoughts that then we have around all of this journey then impact our the way our body will react to the process. So if we look at, and you will know a lot more, a lot better than I do with regards to that, but when we look at how hormones work, they start actually in the brain. So if I'm stressed, if I'm full of anxiety, if my mindset is very negative around what I think about myself, my body, my fertility, then all this stress I have in my body will give a signal that I'm in danger. And if I'm in danger, the last thing that my body will help me do is get pregnant. Because if
I love that. I just want to stop there. If you're joining from Portugal and you'd like to have this in Portuguese, let us know, because Anne-Marie speaks not only Portuguese, but also French and also Spanish, if I'm not mistaken. Yes. So let us know where you're coming in from. So please let us know so we can translate this to the right language so everybody's getting this message, because I think we don't think about stress enough. And it's absolutely right what you said. So from a clinical perspective, if you're stressed, if you don't have enough food, If you have too much food, your body will shut down reproduction. Reproduction is not vital for the body. Your heart needs to keep pumping for you to stay alive. Your brain needs to work for you to stay alive. You know, you need to have lungs to breathe to stay alive, but you don't have to have reproduction. So if the body is at all compromised from nutrition, from stress, from a constant fight or flight, of course, reproduction is compromised. And it's not something we can easily measure with a laboratory test. It's not something we can easily say, ah, yes, you have a lot of stress. Yes, we can maybe measure some hormone levels, but it doesn't really tell us when someone is chronically stressed and not dealing with that stress. So for people who are stressed, what should they do? And again, if you're coming in, oh, we only have, I think, a couple of people, I think maybe people jumped off. But if you have the need to have this in Portuguese, let us know so that we can make sure. So maybe you can just say something in Portuguese, and that way everyone can understand what we're talking about. Maybe just kind of summarize that in Portuguese.
Se quiserem que a gente fale em português, é só dizer, tá bem? But I see it common in English, so apparently the person speaks English, but just let us know.
Yeah.
So it's a difficult conversation, you know, Dr. Lynae, because when we speak about stress, and I see this a lot, you know, I go to groups online, I'm always speaking to women because I want to understand what they're going through. And I know there's a lot happening in December because it's the end of the year, because there's a family gathering in the corner. So there's a lot of thought that are not so positive in this moment right now. The thing is, it's difficult to say, okay, you need to have less stress so that you can, you know, manage for your body to get pregnant, because it's not that simple. And at the same time, every time I go somewhere and talk about what I do, there's always somebody that will say to me, oh, I have a friend, actually, she changed her environment. They went to live somewhere else. She changed jobs and suddenly she got pregnant while she was trying for a long time. So we also have those examples, and it doesn't mean that it's going to happen like this for everybody, but stress surely has a big part. And I think we're so used to it that we don't even see it anymore. So everybody's stressed. So like we can't measure it, as you were saying, and it's very difficult to understand, okay, am I really impacting my...
Oh no, just when we were going good.
Which is a lot.
Yes, okay. Come back. Oh no. You paused for 1 second. Your video stopped for 1 second. So you were saying stress.
Yes, I think a very good thing you can do is try to observe the thoughts that you have around your fertility during the day. So what are your thoughts with regards to, you know, how do you talk about your body? How do you talk about your age? How do you talk about your chances of getting pregnant? How do you talk about the process up until now? So this will be easier to understand if you're talking in a normal way or if you're talking in a more negative way, in the sense that, okay, I'm too old. You look at yourself in the mirror. What are the words coming to mind without you even thinking about it? Just being the observer will give you a lot of information around the emotional part that's happening on the inside. I think that's a good way of starting to really understand, am I having not so much, you know, positive thoughts around the process? Or for instance, when you talk about IVF process, how do I see the process? Do I see it as which is my intention when I work with couples? Do I see it as a step to get to my baby? Or do I see it like, okay, I have to do this and I have to do that, and like it's in my calendar and it's all a to-do list, and there's nothing fun and nice and positive around that? Or do I manage to see it with other eyes? So this is very important, that you understand what your thoughts are, and this will help you understand what's the emotion behind all of that.
So it's perspective is what I'm hearing from you. Having perspective that is a optimistic outlook, or a pessimistic outlook that can add to our stress levels. So if you just joined, it's Fertility Friday, and we're talking about the mind-body connection and how this impacts our fertility. And so if someone now recognizes, hey, I'm actually not saying happy things, I'm not saying, positive things. Oftentimes patients who are going through IVF feel like their control has been taken away from them, right? Everybody else can get pregnant. My sister just had a baby. My coworker just had a baby, and I'm doing everything right. I'm doing yoga. I'm eating organically, and I can't have a baby. This is not fair. So how do you now change that negative feeling that excludes people, from the life they want to have, and help them rearrange it to have a positive, more positive outlook?
I think there is two things that people can do very quickly, and then there is one that might take a bit more time. So the first one will be to put some peace in your day, even if it's just for 5 minutes, whatever it is that brings you some peace. So as an example, I would say, go for a walk in nature, or it might look very basic, but it actually works. So it's really to get these 5 to 10 minutes a day of something you truly like, that makes you pause and makes you think about something else and create some space. Because what happens is that the baby will come when there is more space. When there's no space, there's no openness in the body to also help the baby come. So creating some space in your day-to-day with something that brings you some kind of joy, because what I see also, as you were saying, I see there's no joy. There's no joy. There's no openness. It's really close, and they really feel like they've handed their fertility to somebody else that know better than they do, right? And so it's bringing a bit back. Okay, let me take a bit the leads back onto my process. Okay, so I'm going to do something every day that makes me feel good. So it can be a walk. I also I have on my website a meditation for fertility that I can, like below the live, I can put that so that people can access it. It's free. And it's like, take those 10 minutes, and it's available in Portuguese as well.
If you'd like Portuguese spoken here, let us know. Please put it in the comments.
But the intention is really to bring something that makes you pause and bring you some peace every day, whatever it is. Another thing that I like to orientate women to do, especially, is to do a vision board around fertility. So today we can do it on the computer, on the phone, or you can do it old school and then get some journals and newspapers. And okay, what I want to feel during this, during my IVF process or during my pregnancy later. So I look for images that bring good emotions in me. And so the fact that you create that, it will change your emotion around the process. So it will help you decide, instead of somebody else deciding what you're going to feel, you're going to decide yourself what you want to feel during that process. So it will create that space to see the process in a different way.
Wow, that's so amazing. It's, the tradition I was raised in is that we had to do vision boards. We had to manifest. This was the tradition. It was linked to some philosophies I no longer believe, but this was really fundamental, that you had to see yourself the way you want to be, not necessarily the way you currently are. And, we don't have data. We don't have papers that say, yes, this definitely leads to a pregnancy. But it definitely changes the way you go through the process, right? And oftentimes, I would say, even as fertility doctors, we're not prepared. We're not prepared because oftentimes we're telling people, you're going to need IVF, or this is your percentage, or it may be low. And I think even with the best bedside manner, people are disappointed. And that disappointment can lead to depths of feelings. And we're not prepared, I think, in terms of our training to help people kind of out of those depths. What are the tools besides the meditation and going for walks? What are some other things that people can do? Someone wrote in the chat, support groups really help. Are there other things that people can do to sort of bring them out of those depths that make it really difficult to go through a process like IVF?
Yes, I'll talk about what I do. I know there's a lot you can do, right? There's psychotherapy, there are different types of therapy. In terms of my work, what I do is I look at what's beneath all of that. So what's the belief that the man, the woman can have with regards to their fertility? And what tends to happen is that I see there is a deep fear that sometimes the person is not even conscious of. So let's say, I'll give you a few examples so it's easier to understand. So let's say, you grow up, you get married, or you find your right partner, you have the right job, and now, okay, now I'm ready, I want to get pregnant.
Right.
And when we take this decision, we want it to happen tomorrow, right? Because
yesterday
we've taken so much time to get all of this ready that now there's no question it's not going to work.
Right.
And if it doesn't work, then what happens is that it starts to question absolutely everything about our value as women, specifically, right? So in my work, I look at, okay, what's the belief? What's the deep fear that the person has? And what tends to happen is that there's a fear around either conception, pregnancy, or birth. And it can be different types of fear. I will talk about my experience in terms of what I do, and that's what I shared with you last time we were together, Dr. Lynae. Most of the women that come to me either had some kind of trauma around their own conception. So most of my clients are surprise babies, or during the pregnancy of their mother, so something happened there, or their own birth was challenging. So this is the kind of women that usually come to me. And what we see is that as adults, and despite the fact they have everything ready and consciously they want to get pregnant, they really want that to happen, there is something that they can't grasp that's impacting their body somehow, and conception is not happening, or they can't hold the pregnancy. And it's usually linked to something that has happened a long time ago.
And just to give maybe a clinical side to that, so many people say, how could something that happened when you were a fetus or a baby potentially even impact you today? Well, we know that there's a lot of programming that happens when you are a fetus. When you are in utero, this is when, for females, reproduction is starting, right? Your ovarian reserve is starting. So if mom is smoking, your ovarian reserve is impacted. If mom is stressed, you're stressed. If mom doesn't eat enough, we know this through the studies from the Netherlands during World War II when there was a starvation. We know those women who had those babies had metabolic syndrome because mothers were not eating enough. If your mother has gestational diabetes and you're exposed to high levels of blood sugars, you're also going to be at risk for diabetes. So there's a lot of programming that happens. So we haven't even begun to scratch the surface level in medicine to truly understand what are the psychological programmings that we are subject to when we are in utero. So it makes total sense to me that the mind-body connection, our minds start to form when we're a fetus, right? Our cognitive awareness starts to form when we're a fetus. And people think, they're feti, which is the plural of fetus, are unaware. They're not. You walk into a room as a pregnant person, turn on the light, and the baby goes, whoop. So they are aware, right? And so it's truly important that if you are trying to conceive and you know that you're having stress, that we deal with this before you get pregnant, because you will only perpetuate a cycle of stress. And so I'd love to talk about that. It's not just about fertility, let's get pregnant, and okay, I don't need to deal with this anymore, but it's talking about stress management throughout, because then you're becoming a parent, and being a new parent is definitely a stressful time. So I'd love for you to maybe talk about that. It's not just about getting pregnant.
I think it's important in terms of what you were saying. we can, very easily change the environment, change the food we eat, and it will work. For some people, it will do. For others, we will need to look at what's happening. So if you've been in various cycles of IVF, or if the process is long, then I would recommend you look at something else that maybe you haven't looked before. And coming to what you were saying, of course, if I tend to have something I'm avoiding to look at, whether consciously or not, and I go through IVF, and luckily, everything goes well, and I have my baby, but I haven't dealt to what I needed to deal with, then I'm a mother, and it will be amazing. But within a few months, what tends to happen is that what I didn't look at will come back. So something that we can do for ourselves and for our kids is also, deal with what we have to deal, in terms of, if I know I went through something, but I don't want to look at it. I don't want to mention it. It doesn't exist. And I understand it might impact, because I see also couples where one of them is very afraid of reproducing something they went through. And this also can impact fertility. But this will tend to come back later in life. So what I had shared with you is that there are usually 3 moments in the woman's life where all those things come to the surface, which is teenage years.
Yep, then, puberty, a transition.
Exactly, puberty. So then it will be around when we're, so during the pregnancy, so when the hormones are spiking.
A transition.
Exactly. And then it will come back in menopausal years. So I had heard at one point that, difficult menopause is, I can't remember who said that, but I really fixed it. Difficult menopause is adolescence that wasn't really well dealt with. So it will come back. At one point, the body will use this hormonal surge to make us work on what we need to work. So the earlier, I would say, the better for ourselves first, but also for our kids, because this will impact obviously the babies that we will bring to the world.
Absolutely. And people with periods and women are in a constant state of flux, right? So I love how you pointed out those are nodes within a woman's life. So puberty, right? This is now when we're coming into our first transition. Pregnancy, another huge transition. Postpartum, right? We forget that postpartum is a very vulnerable time. And unfortunately, in many societies, there's not enough support for that vulnerable time. And then menopause. There's almost now all of a sudden menopause has become sexy and people are thinking and talking about it. And there's, a lot of maybe awareness, but still on a day-to-day level, there's not a lot. And so mind-body connection, right? So your hormones are changing and your brain is aware of that change in hormones. And so it's super important that if there's any issue, that we have a space to talk about it. Now at Ovom Care, what we would like to do is help people with their fertility transition for now, but eventually we want to help people from puberty all the way to menopause, because that's our reproductive lifespan. And there's not enough support at every stage. And much of the support is unfortunately siloed and fragmented here and there. And what we hope to have is that, you come to us, you have your baby, and then you come back to us when you're going through the menopausal transition. This is all of what reproductive endocrinology does. And we help from, the medical, biological, organic standpoint. But again, the mind body often gets neglected. What would you say would be your piece of advice for anyone who says, I think I'm fine, I'm not stressed, I don't think I need to go through any type of therapy or anything like that? What would you say is sort of like a toolkit for anyone going through this, even if they think they're not stressed, even if they think they don't have any past trauma? Okay, I think a lot of people think, oh, nothing happened to me, I don't have trauma. We all have experienced some level of trauma. So I'd love to hear your thoughts on that.
Yeah, it's true that, we use the word trauma and we already think about something very big, but sometimes it's something that really doesn't seem like it's a big thing, but it's always with regards to the meaning that we give to it as we
Yeah.
go through that. I think I would like to take people through a very short exercise, but that can bring them some insights around that. So, and people that are live, they can do it now, and people that will look at it on the replay, they can do it as well.
Mm-hmm.
So it's just, pause for a second, close your
Mm-hmm.
eyes.
Mm-hmm. Should I close mine? Mm-hmm.
And just imagine now that you've been given the notice that you're pregnant.
Mm.
And as you're being given this notice now, I want you to look at the first thought that comes to mind.
Mm. I did that.
And that first thought is usually positive, right? When you're in a fertility process or going through IVF. But I want you to look at now the second thought that comes to mind.
Okay. Yeah.
And that second thought is usually the one that will bring up, if you have any fear, any tension, any anxiety, that this second thought is usually where this will come up. So it's a good exercise to do to understand, okay, my body is opening, is it contracting? Am I getting tense when I, put myself, close my eyes and really put myself into that moment and understand how I'm reacting from within. So this is a good insight of, understanding if there's something to be looked at.
So the first thought is like our excitement, our emotions immediately. But the second thought is your brain saying, wait a minute, this could lead to this, or this could happen like that, or maybe you'll be like your mother, or maybe this. And, I think what we don't do enough is think about our thoughts, right? And how those thoughts, do everything to our bodies, right? So I'll just, share something maybe just completely unrelated to fertility. I went to the dentist and I've been going to the dentist. And I think I told you this when we were eating lunch. I've been going to the dentist since I had teeth, and I thought I take good care of my teeth. I floss, I brush, I have a tongue scraper, I use mouthwash, I have a water pick. I have the best dentition I think I possibly can have. And I had been to a couple dentists who said, oh, I don't think your care is not good in the back. And I thought, oh, this is crazy. I go to the dentist 4 or 5 times a year. Of course my care is good. And finally I got a dentist when I moved to Berlin who said, do you grind your teeth at night? And I go, no. And she said, well, how would you know? You are asleep. And I said, oh, good point. I've been grinding my teeth for the majority of my adult life because I process my stress at night. And so she said, you know how I know? All your muscles here are cement, and you need acupuncture and then physiotherapy. And she said, this is where you keep your stress. And this is how I knew for myself, not just something, I read in a book, that your thoughts control your body. And this is what I want for our fertility population, our community, our greater ovum community, to also understand is that, sometimes when we go to do an exam, we put a speculum in, and the first thing that happens is they close up. And people always say, oh, were they abused or do they have trauma? Not necessarily. But if you're afraid or if you're concerned or you have had some type of embarrassment or shame, then this is our natural reaction that happens. And I would love to, as a physician, I'd love to hear, for the medical community, because my dentist was that light for me, right? She was finally the first person who it clicked for me why all these other dentists had been saying, you have, inflammation here, this is what's happening. And as soon as I got a night guard, as soon as I went to physiotherapy, all the inflammation left, just vanished over a course of a month. And so, I can't prevent myself from grinding, but I'm aware of it now. And I'm trying to do a wind down before I go to bed, so I don't go to bed extremely charged with emotion or extremely worked up. And so, how would you counsel the medical community to be a little bit more cognizant of what's happening? I've seen it when I'm trying to do a speculum exam when people are definitely tense. But what else would you say to maybe some signs to look out for so that our patients, we can help them, guide them to practitioners like yourself or to support groups or to psychotherapy to help them deal with the emotions that they're having?
I think it's a conjunction of work, right? I think we should all work hand in hand, right? The doctor has been trained to do something very specific. So
Yeah.
they need to do their job and they need to do it the best way, right? Obviously, sometimes I'd say some words shouldn't be used, like geriatric pregnancy. I can't get my head around this
We
topic.
don't say that anymore in English anymore. We don't say it anymore. We
But
say advanced maternal age, but that
yeah,
also
but
can
I
be,
know you're
yeah,
different as well, Dr.
yeah,
Lynae.
yeah.
I hope they all would be like you. But I
Yeah.
mean, it's I think we all need, each of us need to do our work the best way. And that's why I think it's amazing that Ovum has this intention to help people in different ways, right? So the mind-body connection, the medical part, the psychological part, helping also couples have the opportunity to talk about their journey and share experiences if they want to, obviously.
Right.
But I think the hand in hand work will be the best solution here. So have that, the best medical care, but on the side also, if you feel this is something that's of help, have a kind of therapist, psychotherapist, somebody you trust, which is the first most important point, is to have somebody you trust that helps you
Absolutely.
on that side. Make the most and find some joy within the process. So I think that's the best thing, because you will feel it differently in your body as you go through the exams, the scans. You will see it as, okay, it's one more step closer to my baby and not one more thing to do on my to-do list.
Right.
And your body will react to that. There is no doubt.
Absolutely. And I'm so glad that you said it, I think 4 times now, joy, trying to add joy to the process. So we hope that when you come to Ovum that, you don't have to leave your house to come see us and drive halfway across town and, fight traffic. You can see us online. That's the first thing. So we eliminate that anxiety of trying to race to a doctor's appointment. And then in terms of joy, I think that I'm pretty certain that everybody who's working at Ovum is really a happy and accessible person, and we specifically recruit people who are devoted not only to helping people but also devoted to happiness and joy. And I think that makes a difference, because oftentimes people think of physicians as being very stuffy and very formal. That's not what we are at all at Ovum. And I think that we try to inject joy as much as possible. And when you come in, we've had people have birthdays, with a little birthday cake at their retrieval, after their retrieval. Of course, you can't eat before. We have open house so people can come, touch, feel, look. So they don't feel that they're being pressured. I've heard a lot of people say they feel they're pressured into a fertility service. That's not our MO at all. We want people to understand that IVF doesn't have to be stiff. It doesn't have to be overpriced. It doesn't have to be just for the elite. It can be for everyone, and it can also be fun. It can also be fun, even though maybe the reason you're there, it's not exactly what you anticipated, but if you change your perspective, it can also be fun. It can be an adventure. Another fun way to have a baby. So we only have about 5 minutes or so. And for those who stayed on, thank you for joining us for Fertility Fridays. Sorry for the technical glitch that we had at the beginning. I would love to hear if anyone has any questions. So I've had some people say that joining a support group is important because it decreases your cortisol levels. So thank you for that. Whoever put that in, I think Kristen wrote that in. And she has a support group. Okay, awesome. Thursday nights on Zoom, whatever works. So any questions that we have for Anne-Marie, because we're about to wrap up. But Anne-Marie, you'll be joining us for a webinar, hopefully in the new year. and also some things in our clinic in the new year. So can you talk about some of the things that we talked about way back when doing in the clinic? So after hours, these are the types of things that we'll have.
So the intention is to start doing some group therapy in terms of, so it's not really therapy, I'd say it's getting together and having the opportunity to share the journey. So we'll also see, because as we were talking with Dr. Lynae, we need to understand what people need, and if they feel like sharing their journey in a group, or we will also see how to adapt the best way to the people that are going through the process. But what I see is usually very, it's easier for women to share their journey, a bit more difficult for men, but we will adapt to the people going through IVF at that moment. And the intention is for people to be able to share their journey and understand, you know, we're not alone. We're going through this process, and have some kind of help from my side as well, and guidance as to how we can lower the stress levels, enjoy a lot more the process, find a meaning in all of that. And I think one very important thing is making ourselves a priority during this process, because it's very easy to forget about ourselves, because there's so much to take care of, to remember, to do, and we stay on the side. But at the same time, everything will happen if, you know, this body is well taken care of. So I'd say one last message is make yourself your priority during this process. Do something every day that brings you some kind of joy, that helps you pause, get out of the everyday turmoil, and bring you some peace and some joy inside. I'd say that's the most important thing, especially in December.
I love that. So thank you so much for joining us. Last week we talked about nutrition. The body needs good fuel. This week we talked about understanding the mind and body connection. What are we going to talk about next week? We need to talk about maybe how to deal with the holidays, because as you said, the holidays are coming. They're coming. The questions are coming. What do you say to this aunt? What do you say to that uncle? So stay tuned for who we have for next week on Fertility Fridays. That almost wraps it up for the day. If you have any questions, now's your time to ask Anne-Marie. Otherwise, Anne-Marie, how do people find you?
So on Instagram and mainly on all platforms, it's Free Infertility, and you can find me there. And I'll make sure I drop the meditation I said earlier below the live. And I want to thank you, Dr. Lynae, for your openness, because this is something that, you know, it's rarely being seen as well. So that's also a proof that you're kind of different doctor as well, for your openness to so that I can share also this, and people have access also to different tools on their journey, which is the intention, right?
Yeah. That's the intention, right? Sometimes we all need different ways of getting to the same place, and baby is the place for Ovum Care for a lot of our patients. But we want to make sure that people get to the baby in a healthy way, and that beyond Ovum Care, that they have a healthy journey to parenthood and in parenthood. So thank you so much. Thank you for your time on a Friday night with us. We appreciate it. And if you're just tuning in, hopefully I can send this live to you. Thank you for coming, all of you who all show up for our Fertility Friday. We'll see you next Friday, same time, same place, hopefully with no technical glitches this time with Instagram. And Anne-Marie's going to put her contact information and also her meditation, because it's so important. If you're just tuned in, if you haven't heard anything else, take care of yourself.
Exactly. Yeah. Thank you very much.
Thank you. Thanks for joining, and we'll see you next time on Fertility Fridays. Bye-bye. That's all for now.